you're coming from. Welcome. My name is Dr. Christopher Tarnay, and I am the Chief of Urogynecology here at UCLA in the Department of Obstetrics and Gynecology. And today we're going to talk about female bladder leakage. And we're going to focus in on solutions. Solutions how to get control of this very challenging problem for women. So, during the webinar, feel free to ask questions. We've got Cleve over here. He's monitoring our Twitter account. You can use the hashtag UCLAMDchat, UCLAMDchat, or you can just put comments on Facebook. And during the webinar, we'll be tracking them, and at the end, I'll address some questions. All right, I'm going to start off with some geography. Does anyone know where this might be? This is the Blue Ridge Mountains, and it's in northern part of Virginia. I had the opportunity as a medical student in Georgetown when I was in DC to go and visit them. And one thing I didn't know at the time was that the Blue Ridge Mountains and the vagina share something in common. I hope I have your attention now. And what they have in common is similar topography. Women have estrogen, and estrogen in the vaginal area creates a thickening, and that thickening creates small little buckling of the tissue, creating tiny folds called rugae. And these rugae are very important. They create a functional impact on the vagina. It has rugae to allow lubricants and secretions. It also, those rugae allow stretch. And the rugae are like this peaks and valleys. And that stretch allows function during childbirth, during intercourse. And the problem later on, as estrogen decreases, either during menopause or estrogen decreases during breastfeeding or after childbirth, is that elasticity goes away. The vagina tissues can flatten, and those rugae flatten. It becomes thinner and drier. And that can lead to challenges during these transition times with intercourse, also bladder control. And that's what I want to talk with you about today. Female bladder leakage is urinary incontinence. What is urinary incontinence? The involuntary leakage of urine, or simply put, urinating or leaking urine when you don't want to. One of the biggest questions patients have for me when they come into the office is they feel kind of isolated. And they go, is this the only thing happening to me? Is this urinary incontinence? Am I the only one who has it? And it's important that you know that it's extremely common. 2 out of 3 women have a lifetime risk of suffering from urinary incontinence. Now, although incontinence increases as one gets older, it actually can happen any time during the lifespan, and women can experience symptoms at any time. It affects over 200 million people worldwide, and in the United States alone, at least 25 million. And of those 25 million, 9 to 13 million women have either bothersome or severe symptoms. How about a few more facts? Urinary incontinence is underdiagnosed. It's underreported, and as I mentioned, it increases as we get older. It's primarily a female problem, as over 2/3 of people who have urinary incontinence are women. There was a study looking at random sample of 45,000 different households, and during that survey, 37% of the women reported incontinence just within the last 2 months. In the elderly, over 70% have complaints of urinary incontinence. And this alone can be the reason for elderly individuals to be transitioned to a different living situation, to a skilled nursing facility, to assisted living, just to manage the incontinence. This graph shows that as we get older, urinary incontinence becomes more common. And young women in their 20s and 30s, about 30%. Middle-aged women, 40s and 50s, 40%. And in 60s, 65, beyond the menopause, over half of women will suffer from urinary incontinence. Another question I hear an awful lot is it normal to leak a little urine, or it's just a little urine? That's normal, right? No, it's not normal. Leakage is common, but it's not normal. And it's really important to understand that women who suffer from incontinence can do so in a very gradual and an insidious fashion, because it's a gradual and insidious problem. So often women don't think it's a medical condition and don't bring it up with their physicians or medical providers. This causes delay in women seeking care. And it's very important for us to communicate and to communicate with your friends and for you to know one doesn't have to live with urinary incontinence without seeking treatment. It's important. Although urinary incontinence isn't life-threatening, it's what I call quality of life-threatening. And it can affect a woman's life in many different domains. Physical, reducing physical activities because they don't want to leak. Psychological, they feel like they're old. They're concerned about the odor. They lose their self-esteem. Higher rates of depression in women with urinary incontinence. They reduce their social interaction. One woman said to me, I never go anywhere without being near my boyfriend, John. That means she was always near the toilet. She felt shackled to it. Padding, undergarment use, very costly and problematic. Some women will say they pack 2 suitcases when they travel, one for their clothes, one for their pads. Occupational, women who are working, this can cause a reduction in going to work and avoidance of intimacy. All right. Women with incontinence suffer in silence. And this is part of the dialogue that we want to change. Survey of women suggests that women don't like to talk about this problem, even with their provider. And candidly, doctors aren't so great at it either. We don't do a great job asking patients about it. 3 out of 4 doctors in one survey, women after their visits during their annual screening, the doctor didn't even ask them or screen them about issues of incontinence. This leads to a delay. Women will often wait over 6 years before living with the condition before they even bring it up. We need to change the way we are looking at incontinence, bring it out from the shadows, bring it out from the bathroom, and start to recognize it. Times are changing, and one of the ways and one of the avenues is the pharmaceutical companies. The companies that are selling medications and treatment are going to direct-to-consumer marketing. This ad was during the Super Bowl last year for a new drug. You see this in print ads, media ads. Playtex has gotten in on the action. They have a product called Impressa that's designed to help prevent urinary loss. It works by inserting in the vagina, similar to a tampon, to compress the urethra to prevent the leakage. We have celebrity endorsements now, coming to the front, talking openly about female bladder leakage and urinary incontinence, and offering ways for women to get control. But more importantly, this, I think, is going to help bridge the big gap so we can start having a conversation. So there's 2 main types of incontinence. Stress urinary incontinence, or what I would call exertional loss of urine. So this is anytime losing urine with coughing, laughing, sneezing, or physical activity. Hey doc, I don't jump on the trampoline with my daughter anymore because it causes leaks. I wanted to play hopscotch. I can't do that with my daughter or my kids. It's common after pregnancy, particularly pregnancy that results with a vaginal delivery. So stress incontinence is basically increased pressure on the bladder that overcomes urethral resistance. Coughing, laughing, sneezing, all can create urinary loss by pressure and a lack of support underneath the urethra. The other type of incontinence is urge urinary incontinence, or I think this is the symptom when patients say, I gotta go, I can't make it to the toilet in time. Otherwise termed overactive bladder. Overactive bladder is to do with women have this overwhelming inability to resist the sensation to urinate. It has to do with early and inappropriate signaling of the bladder. Normally, we should be able to sense our bladder filling. If we're out and about, we're say, not now, I'm in the movie theater, I'm at the store, I'll wait till I get home. Overactive bladder is a problem when you're unable to suppress that sensation, and either due to increased sensation or muscle contractility, squeezing the bladder involuntarily, triggering urinary loss. So urinary urge incontinence is leaking urine with strong urge. It's also typified by urinary frequency and urgency. Often women can't hold their bladder more than 2 hours at a time. They feel like they have to go, and they may leak right before they make it to the toilet. That's urinary urge incontinence. Sometimes it causes patients to wake up at night. Typical, normal is about 1 time, but anyone who's waking up 2, 3, 4, even 5 times a night to urinate is classic for overactive bladder. One problem patients often relay is that, "Doc, right when I get home, I pull my car in the driveway or I'm walking up the walkway to the front door, I put my key in the door. I got to immediately drop my bags, run to the toilet." And when I ask them, they go, "Yep, that's me." It's called lock and key syndrome. So who gets urinary incontinence? Women 2 times more likely than men. That sounds awfully unfair. Why is that? Anatomy and risk factors. Quick anatomy trip. We'll talk a little bit about the physiology. The kidneys filter the blood. The waste products of that blood filtration ends up in the kidneys and delivering it to the bladder through conduits called the ureters. The bladder is a storage organ, and it should store urine comfortably and painlessly until you're ready to urinate. And then once you're ready to urinate, it goes out through a tube called the urethra. One of the reasons women are particularly vexed with this problem is physics. They have a short urethra, very short tube. Men typically have a longer tube like a urethra, increased resistance. Women with a shorter tube, less ability to resist. And so anything that might cause detriment to the anatomy can trigger urinary incontinence, like vaginal delivery or occupational exposures. We'll talk about those. What are the risk factors? Age. As when we get older, we talked about estrogen. As estrogen recedes, the vaginal tissues change, leaving women susceptible to overactive bladder and stress urinary incontinence with the changes in the bladder lining. Pregnancy. Pregnancy itself does something to contribute to bladder weakening. If the pregnancy results with a vaginal delivery, the more vaginal deliveries, higher risk of urinary incontinence. Medical conditions with chronic repetitive straining, coughing, asthma, chronic constipation, smoking can all contribute to urinary incontinence. Activities. Women with occupational exposures. There was a study in Sweden looking at women who worked in nursing homes, transferring patients, lifting gurneys. Those women, when they compared them to age-matched controls, had higher rates of pelvic floor problems, including urinary incontinence. Obesity. The more weight you have, particularly if it's over 30, more pressure on the bladder, more pressure and stretch to the pelvic floor. And genetics. Some people are just prone, and this is a big area of research and trying to understand which women might be at risk. This is a slide demonstrating the older you get, the more common the problem is. I talked a little bit about pregnancy. This is a cartoon just to show